Hello, anatomy colleagues. This is Dr. Alsop, and we're going to end our discussion on joint basics with a high-level outline of arthritis, because arthritis is hugely important in terms of joints. So exactly what we're going to talk about. We're going to talk about the three main types and a few specifics regarding those. Okay, so arthritis is a form of rheumatism that specifically affects joints, and this is kind of the key here. So rheumatism is just really any painful disorder that is going to affect any supporting tissues of the body, but that doesn't involve direct injury or infection a lot of times. So these structures can include bones, muscles, tendons, and ligaments when we're talking about rheumatism as a whole. But when we're talking specifically about joints, this is going to be arthritis. And really what will characterize arthritis is going to be joints being swollen, stiff, painful is a huge one here. And so there are three main types. There's osteoarthritis, or OA, which is typically what a lot of people think about when they think of arthritis. There is crystal arthritis, often referred to as gout, and there is rheumatoid arthritis, or RA. All right, so let's start with osteoarthritis. And again, I mentioned this is typically what people think about when they think of arthritis, and this is a degenerative arthritis, or kind of a progressive, often irreversible type of arthritis. When you hear wear and tear arthritis, this is osteoarthritis. And what's really happening here is the breakdown, particularly of that articular cartilage that's on the ends of bone. And remember, that doesn't heal well. It's mostly avascular. So generally, a lot of times what will happen is there's not going to be a lot of movement associated with those joints. It can lead to a need for a replacement. So think of a hip or a knee replacement. A lot of times that's due to osteoarthritis. Certainly not all the time, but that's one of the major causes. So this is kind of the one that a lot of people think of. Crystal arthritis, or gouty arthritis, occurs when sodium urate crystals become deposited in and amongst soft tissues of the joints. And this can happen in any joint of the body, but generally one of the first regions that this occurs to, or the most common regions, is that this first metatarsophalangeal joint, or kind of that big toe region. And these crystals will really irritate and lead to inflammation of the joint structures, in particular in this first metatarsophalangeal joint. Food and drink that are high in uric acids, like processed meats, red meat, alcohol, that can lead to higher levels of this type of acid, and that can lead to a higher risk of crystal arthritis. And lastly, rheumatoid arthritis, or RA, is an autoimmune disorder, which really means that that immune system is going to attack its own joint linings, specifically really that synovial membrane, sometimes cartilage as well, but really that synovial membrane is going to be most often affected with RA. Or you'll have that higher incidence of inflammation of the synovial membrane. The joints in the hand tend to be affected in greater frequency in RA. All right, excellent. So question answer time. Another common name for crystal arthritis, so you very rarely hear the term crystal arthritis, just colloquially, that's often referred to as what? Is it gout? Is it osteoarthritis? Or is it rheumatoid arthritis? And hopefully you're landing on gout, or A is the correct answer. Very rarely, this is the technical name for it, but more often you hear it referred to as gout. Osteoarthritis, a lot of times you just hear osteoarthritis referred to as arthritis. That's a bit too vague though. And then rheumatoid arthritis, that's going to be the autoimmune version of arthritis. Often you just hear it referred to as RA. Okay, thank you so much for your time here. We'll talk about a few of these joints that have a higher incidence of osteoarthritis when we talk about those specific joints. But really you need to think, when you think about arthritis, you need to be thinking joints. Excellent. Thank you so much for your time and attention. And let's move on to skeletal muscle basics.